Hi, I'm Carolyn Leonard. I'm one of the dietitians at the Prompt Care companies. If you're watching this video, you're likely either a patient or a family member of a patient that's at home with us on enteral nutrition support. We wanted to create this video to go over some easy nutrition basics at home. Enteral nutrition support is the administration of nutrients directly into your GI tract, whether you're no longer able to eat by mouth or you're unable to meet all of your needs solely through the oral route. You'll either get your nutrition through a G-tube or a J-tube. Your G-tube goes directly into your stomach. The J-tube goes directly into your small bowel. There's also another option that some people may go home with, which is called an NG tube that goes directly into your nasal cavity and ends in your stomach. Before you go home, you'll also be notified and taught whether you're getting your feeds through the bolus route, gravity, or pump feeding. Today we will go over all three methods of feeding and what supplies you'll need to successfully administer this at home.
Supplies are dependent on what administration method you are going to use. For bolus, you will receive 30 60cc syringes, gauze, and tape. For gravity, you'll receive an IV pole, 30 gravity feeding bags, gauze, tape, and 4 60cc syringes. And with pump feeds, you'll receive the feeding pump, an IV pole, 30 feeding bags, gauze, tape, and 4 60cc syringes. There are several things that you can do in terms of cleaning and safe handling for the formula as well as your monthly supplies to ensure not only cleanliness but sanitation. So for formula, you want to store your unopened cans or Tetra Paks at room temperature in a dry location. You always want to check the expiration date. And before opening, you want to shake the can so that everything is evenly distributed. You want to make sure the top of the can is clean, and when it is opened, use immediately, and anything that's in the refrigerator needs to be discarded after 24 hours. Please refer to the hang time section of this video for further information. If a refrigerated formula needs to be used, you want to make sure that it returns to room temperature before given to the patient. This may cause some GI intolerance. So you want to take the formula out of the refrigerator and set in your space for 30 minutes before use, and then throw away any formula that hasn't been used for more than 24 hours. With feeding bags, you will have enough bags to discard after daily use, but in between, you want to clean with warm soapy water and then air dry. With the syringes, you will be also provided one daily. They can also be cleaned with warm soapy water and air dried between each use. With the gauze and the tape, the dressing should be changed every day or sooner if it becomes wet or soiled. You should have been taught this or educated on this by the nurse before you're discharged, but you want to follow those instructed that were provided to you before you were at home. And check for any changes in your skin or tube and report any redness or swelling to your nurse or doctor as soon as that happens. Some of our patients utilize an extension set with their feeding. So if you have a low profile button, you need an extension set to essentially connect the button to the feeding method. So if you are one of those patients, we will supply extension sets for a month, so one per week. At Prompt Care, our enteral feeding tubes and extension sets do have ENFit compatibility. So the NFIT system is basically to help prevent with tube misconnections so that you can only supply formula and free water through the tubes. So every extension set, syringe, long tube peg, and NG tube will be designed with a specific NFIT end so that you can only use products designed for the enteral tube feeding access. The button style G tubes will not change at all. Only the extension sets that connect to them will now have NFIT connections. And again, we will be able to supply all of these.
So with bolus feeding, and again with any feeding, you want to make sure the first thing that you do is wash your hands thoroughly and make sure that your workspace is clean as well. With the formula, you want to check the expiration date. If it's over the expiration date, discard immediately, let us know. But usually they typically have a long shelf life, so this typically does not happen. If it is within the time frame, of course, feel free to use. If you have a can, make sure you wipe that off with a wet cloth. Same thing with the Tetra Packs. These are easier to keep clean, but still doesn't hurt to kind of wipe it down first to make sure there's nothing that gets inside. And you also want to make sure you shake it up a little bit so that it's all evenly distributed and nothing is stuck at the bottom of them. So with bolus feeds, again, this is typically the quickest method and something that can be done along with meal times. When you're out, it doesn't have to be at home. It's really whatever works best for you and your family. So the first thing you want to do with bolus feeds is put free water through the syringe and put that through the tube first before you feed the formula. This is twofold. It helps with the prevention of clogging the tube feeding, or the tube itself, as well as, keeping your adequate hydration throughout the day, which is extremely important. Before you are discharged, either your doctor or dietitian will give you a prescription for how much free water you should get along with your formula every day to ensure that your hydration is being met. So with the feeding tube, you want to make sure that it's clamped at first. There's a cap on the syringe. You can take the cap off of the syringe, pull the plunger out of the syringe, fill it with water, whatever you're prescribed per time, and then connect the tip of the syringe directly into the feeding tube port and declamp the tube and then plunge the water through. You may have to do this a few times, of course. This only holds 60 cc, so depending on the amount of water you want to flush through, you might have to do this 2 or 3 times. Same with the formula as well. Once you feed through the water, you can, refill this with your prescribed formula. With the bolus feedings, this should take about 20 to 30 minutes for each feeding, depending on the amount. So again, if you want to start slow at home to make sure that they're able to, accommodate and make sure that they feel okay, there's no bloat or nausea or diarrhea or anything like that. And just a reminder too, bolus feeds are for G-tube fed feeds and through the stomach only. You cannot bolus feed through the J-tube into your small bowel. You likely won't be able to tolerate that and you will have diarrhea. So that is why we really only bolus directly into the stomach.
Here are the steps that were described in the video.
So another form of administration is through the gravity method. This is when you fill your feeding bag with formula, and without a pump, you connect the feeding bag into your tube feeding site, whether that's your G tube or your J tube, and the formula is fed through gravity itself. So each can, 8-ounce can, typically takes 20 to 45 minutes to go through. The higher the bag is hung, the faster the formula is going to be dripping through the tube directly into your stomach or bowel. And the lower it is, then of course, the slower it will flow as well. And again, that's kind of a trial and error process at home. What is most comfortable for you? Again, you want to have that 90-degree angle, sitting up completely straight while this is happening. Clean your hands thoroughly, clean your workspace. Some of the bags actually have roller clamps. This one doesn't, but you may get bags that have a roller clamp that you can actually clamp. So again, control the rate of the formula coming through the bag, the tube itself, directly into your feeding site. And again, this is when a pump isn't really necessary, but the bolus method is a little bit too much volume at a short amount of time that you're not comfortable or you're unable to successfully take the formula in without any GI symptoms. So we do have many patients at home with us that use the gravity method.
Here are the steps that were described in the video.
So for pump feeds at Prompt Care Companies, we do have both the Joey Kangaroo pump as well as the Moog Infinity pump. We also do provide the orange Infinity pump that's typically used for our patients that are being fed primarily with breast milk, just because the breast milk is thinner, so the viscosity sometimes throws the pumps off, and it works best for those patients that we find. But today we have both the Infinity pump and the Kangaroo pump, and I am going to go through the process of setting those up for you. You should, of course, be taught by the respiratory therapist as well as the nurse before you leave your hospital or clinic. We do provide that training for you so that you are completely comfortable by the time that you do go home with utilizing these. But again, it's something that we're happy to go over just as a reminder. Both of the manufacturers for the individual pumps also have tutorials on their own websites as well if you have any further questions. Pumps are both made to be utilized and used. If they are kind of upside down or tipped to the side, they typically will still work regardless. So you are able to take them out and use them again at home. You can attach it to you pretty discreetly so that no one essentially knows that you're being fed, which is great. But for our purposes, we're going to make sure that I'm teaching you on the IV pole so that everyone can see. With the Joey pump, once it is charged, the battery life is about 18 hours. With the Infinity pump, the battery life is about 24 hours. If your rate is over 100 milliliters per hour, this will decrease the overall battery life, but if it's under that, which most of our patients are typically fed less than 100 or 125 mLs per hour, that will have the battery life will be 18 and 24 hours when fully charged. And when you're at home, it's always just a good reminder to have it plugged in so that we know that it's, full, the battery life is fully charged. So hang times, there are appropriate hang times with different formulas. Most of the formulas that you see are ready to pour. So the ones that are in cans or Tetra packs, so you don't have to do any mixing at all. When you pour these formulas into the bag, the appropriate hang time is a 12-hour max. So once it's in the bag for 12 hours, you need to discard after that. If you only utilize half a can or half a Tetra Pak, you can put the formula back into the refrigerator and discard after 24 hours. But if it's out just in the bag, again, 12 hours. With any powdered formulas that you're mixing with water, so a lot of our pediatric patients, moms at home or dads at home mixing the formula, those again in the bag, that's a 4-hour limit. So once that's been hanging for 4 hours, you need to discard if there's any left. Again, you can keep things that are pre-mixed in the fridge, but you want to get rid of that after 24 hours. Anything that you're adding to, if you're adding anything, whether that's MCT oil, added carbohydrates, added any extra calories to the bag, any water, that bag can only hang for 4 hours before you need to discard. In terms of the feeding bags themselves, you'll get one a day for the month. So in between feedings, if you feel it's appropriate, you can actually rinse out the bags themselves. You want to use warm, soapy water and let them air dry.
All of our pumps are designed to set the rate for over an hour. However, you may go home with a prescription to have your feeds run over a fraction of an hour. When this happens, we need to do a quick conversion so that you can set the pump for the appropriate amount of formula to be run. The conversion equation is the prescribed volume over the prescribed fraction of time. So we will use the example of 30 mLs an hour. If you do have the prescription of 30 mLs per hour, you'll go home and set the pump for exactly that. But what happens if you go home and your prescription is to run 30 mLs over 45 minutes? This is when you have to use this quick conversion equation as well as utilizing this chart. So I developed this chart that is in 15-minute increments, and it breaks down what that looks like in terms of conversion. So for the example of 30 mLs over 45 minutes, we want to find the 45 minutes. And under that, we see that it's 0.75 of the hour, essentially. So we just plug in 30 over 0.75, and it comes out to be 40 mLs an hour. So to run 30 mLs over 45 minutes, we set the pump for 40 mLs over the hour. Once 45 minutes has gone by, 30 mLs will have run through the tube. With any method of administration, whether that's bolus, gravity, or continuous feeds with the pump, we want to make sure that we are flushing with free water both before and after every feed. By doing this, we are preventing any clogs or anything that can build up within the tubes, and we are also ensuring appropriate hydration status for the patient. So as well as your formula prescription, either your dietitian or physician will let you know how much water, free water, you should be giving yourself throughout the day to maintain your hydration status. But again, whether it's bolus, gravity, or pump feeds, we want to make sure that we are flushing water through the tube both before and after every feed. When using breast milk to feed, The hang time is 4 hours, but it goes down to 2 hours if you're adding any extra calories or supplemental formula to the breast milk itself. I have a lot of new moms that are worried that because the baby needs to be fed enterally, if this changes any aspect of the mother-child bonding time, we suggest, still holding the baby while they're being fed through whatever administration method so that the bond can still take place. And breast milk can be fed just like you would feed formula. You can use the bolus method or a feeding pump. Breast milk does tend to separate, so you may need to kind of shake or snap the bag a little bit throughout feeding, but otherwise there are no issues. Again, like I said before, with any pump, they are made so that they can feed breast milk through, but you will likely get the Infinity Orange pump, and this is designed so that it funnels the milk towards the tubing, so it's easier to get all of the breast milk out of the bag and into the tube, and then of course into the baby as well. You want to store your pump in a cool, dry area away from any moisture or flammables. You want to make sure the pump is disconnected from the power source before cleaning, and then after cleaning, you do not want to connect the power source until the pump and the power adapter are thoroughly dried. For the Joey pump, a mild detergent to be used for general cleaning, so any common dishwashing liquid. And for disinfection, you want to use a bleach chloride solution, any wipes such as that. And for anything else, you want to read the label for chemicals and avoid the ones that are listed here. You want to make sure excess moisture is evaporated from the cord prior to plugging it back into the wall. Do not use strong cleaners that I mentioned before. Again, look at this list and refer to any of your cleaning products at home, and you want to make sure you read the labels to make sure you won't cause any damage to the pumps themselves. With the Infinity pump, same thing, it's similar to the Joey. It may be cleaned with warm soapy water or a standard dish soap that is recommended for the Joey pump, and a non-abrasive sponge or a soft cloth. And you can use a cotton swab to clean the pathways of the cassette where you're actually connecting your feeding bag into the pump itself. And you want to rinse the pump by holding under a stream of warm water and dry with the clean cloth, and avoid any, again, harsh disinfectants that may cause damage to the pump itself.
So with the Joey pump, I'll try to get as close as I can so that your focus is on the pump and not necessarily me, because it's more important to see the pump correctly. But you want to make sure that it is attached to the IV pole appropriately, and you'll know it will be when it's able to kind of sit upright by itself. So the power button is on the bottom right, and you want to hold that down. You'll hear that beep. You'll sometimes see the Kangaroos jump, the Joeys jump. And the first thing that it will say is load a set. You will see on the pump it says load a set. This means that they are asking you to attach your feeding bag into the pump so that it can feed correctly. This is what you want to attach to the pump. You look at the top, it gives you a nice illustration of what they're looking for, and again, the pump will notify you if you are doing it incorrectly or correctly, hopefully. So I will go ahead and show you what this will look like. You'll take the feeding bag, the tube itself, and you'll see this little tab, and you want to attach that to the top here with the side facing down. and it'll fit kind of right nicely in there. And then you take this part of the tube and bring it around the rotor, and then you'll see this other side with the little black tab, and you have to pull it, but don't pull it too much. You don't want to overstretch it. Just pull it so that it fits into there nicely. You'll kind of hear that happen. And you'll see on the pump that it says set loaded. Now that the set is loaded, we are going to prime the tube feeding bag as well as the tube itself. And what priming is releasing any air bubbles out of the tube so that we don't create any GI symptoms, especially bloating, nausea, any intolerance to the patient themselves. So we want to make sure that the tip of the feeding bag is still covered during this process, or we can also, if you have a free cup or something, everyone has different ways of doing this, but if you have a cup at home, you can prime the tube and any extra formula can be dripped into the cup, and then you can pour it back into the bag, or you can just kind of cover it with your hand if you'd like, or keep the cap on so that none of the formula spills over. With the Joey pump, there's two options. There's a manual prime and there's an auto prime. So to prime the pump, where it says prime pump, we just hold that arrow, and you'll see the auto, and you'll see the hold to prime. The auto prime, you just hit that. It says priming. There's obviously no formula in this bag, so it's not actually doing it, but the rotor is moving, and what it's doing, it's probably going to alarm. You can hit stop. Automatically will run the tube, and you'll start seeing it come down through the tubing, and once that gets to the end, it will stop. If you're doing it manually, you have to hold the button down and, again, hold it until you are done with either pouring it into a cup or pouring it back into the bag, or kind of just stopping it when it's at the very end, so all of the air bubbles are gone. You can also look at the bag itself and see if there's any bubbles and kind of either like snap the bag a little bit. Sometimes it helps with reducing air in there, but once it's primed, you're ready to go. You can take the cap off of the formula. I just screwed the whole thing off, but you just take the cap off and insert this tube either into the extension set or directly into your G or J tube, and you're good to go. Of course, we have to set the rate first, but after we prime, typically when everything is set, that's when you're kind of good to go to connect to the patient and start feeding. So this opened a little bit because it's stretching a little bit, but that's okay. So when we're done with priming, we hit done, and then it goes back down, so we're able to close it. And then we can hit the adjust feed button, and you'll see feed rate or feed VTBD is volume to be delivered. So that's your total volume that you want to be delivered, and the rate is over an hour. If you have any questions with the rate or calculating the rate per hour, especially if a formula is given over 45 minutes, that is something that me as the dietitian are happy to answer any of these questions and figure that out for you. It's just an easy conversion equation that we do to tell you how much should be run per hour, since these pumps run per the hour. So for now, we're going to use an example. So the feed rate, you're going to hit that. And again, all of these arrows kind of match up with these lines. And you can, obviously, the max is 400 mLs. Many patients are never going to go that high, but that is the max that you can actually enter. Most patients you'll see, I don't want to say most patients, but you'll see anywhere between 40 mLs, 30 mLs an hour to 150 is typically the high point of where I see. So for this example, we'll just do 75. So we don't have to enter anything into this arrow because that will be over 100. this arrow will be the 70 for 75, so we can just keep hitting the arrow until we hit the 7. If we go over that, you just keep hitting that arrow until it goes back. And then we want to go up to 75, so we go down to this arrow, which aligns with this other arrow on the screen, and you'll wait until you see 75. And when you're done with that, the top arrow says enter, so you want to enter that. It's very simple. So then you'll see the feed rate is 75 mLs an hour. Then you want to go down to the next arrow where it says the feed volume to be delivered, so that's the total. And for this, we'll say 250, which is typically a can's worth. So if you're filling this up, you'll get 75 mLs per hour, but it will run until the total can is in the bag. You also can, put a high number on this as well. It's going to run until the bag is empty regardless. But for these purposes, we'll do 250. So the max for this is 3,000. That's typically not going to happen because you're not going to have a bag that holds 3,000 mLs or 3 liters anyways. It's likely going to be a liter max. So 1,000 is something that an example that is familiar to see, but again, we're going to go really low here and just do 250. So we're going to ignore this first arrow and go down to the third, and you'll see it goes to 100. Now I'm going to go to 200, so I'm done with that. I'm going to go down to the next arrow until I hit the 5. So 250 mLs of total volume to be delivered, and then I'm going to go to the top arrow again where it says enter and hit that. And then you'll see on the main screen the feed rate is 75 mLs an hour, 250 mLs total volume per feed. And then you'll see 0 mLs fed underneath the 75, which means that we haven't started running the feed yet. And that will increase obviously as the feed is given over time. When we're done with that, again, this is when you uncap the feeding bag, insert it into the extension set or the feeding site directly to the patient, and then you can hit run. So we'll hit run. And then you see the kind of the raindrop or the formula drop, and it shows that it's running. And you can hit a button that says hold, and that will hold the feed. And there's many different options. You can either clear the volume, adjust the settings, resume in a minute, or run. So again, there's many different options, and it's really easy to see. It's pretty user-friendly. There are unfortunately different alarms that will go off, but again, it should be self-explanatory. Any issues, questions with this, please call us directly. So for now, we will just say run. And the great thing about this will stop once it's finished, and the settings will remain the same, which is great. So most of our patients at home, once this pump is set, we turn it off, we turn it back on, the settings remain the same. So we really never have to adjust it, but just for the readjustments or to start the pump, this is really as easy as these steps. And we'll hold the button down to power it off. So with the Infinity enteral light, we have a feeding bag that goes along with it, and it matches in color, so there's no question. It'll say enteral Moog on it, the manufacturer, so this will connect appropriately with the pump itself. To turn it on, really simple, on-off button, hold that down, it will light up, and some numbers will come up. Okay, and then the rate is, right now it's set, because there's no rate set, it's set for 0.1. So you can actually set these rates to the first decimal point, which you can't necessarily in the Joey. So Again, we're going to use the same exact example set rate that we did with the Joey pump. We're going to do 75 mLs for a total of 250 mLs per feed. So we hit the rate, which is, it's already there, so if it wasn't there, we would hit the rate, and we use the plus or minus, and we go up, and you can hold that, and it'll go pretty fast, so we're going to wait until it says 75. So we hit 75, so it says rate 75 mLs an hour, so that's done. Then we hit the rate dose button again, and it'll go to the dose, and then this is the how much volume you want to give per kind of interval feed. So again, I want this to be 250, so we can just hold down on the plus button, and then it starts kind of picking up speed. And it's easy if you go over, you can just hit the subtraction, and now we have 250 mLs. So we have the rate for 75 mLs an hour, and then the dose is 250 mLs, which is great. So another note for the dose, we can continue hitting the plus button until you see the letters INF. That means infinity, and that means that the formula in the bag will just run until the bag is empty and the pump doesn't read any more liquid or formula. So you can always leave the dose as INF, which is infinity, so you don't have to worry about it. So same with the Joey, you want to prime, and this is alarming because it's saying set the load, so we will hit that again. Okay, so I went back to the rate, and what I just did is we opened the front door with the Joey. There's a top door, this one is the front door, and like the Joey bag, the Infinity bag also has kind of an easy set too. So you'll see that this is kind of a loop, and this the loop itself will go over the rotor. And we have to pull it a little bit so it fits right in, and you'll kind of hear that snap, so that works. And then we can close the lid. Okay. And then of course you want to hang the bag again. This pump is a little bit lower on the IV pole than we would have it, just for the video purposes so that you can see it. But you would otherwise just hang the bag on the IV pole, again, at least 6 inches above the pump so that it works accurately. So we'll see prime and net bump beeps once, and then of course it's not alarming because you actually can prime. You can do this before you set the load, and you, again, the same thing with the Joey, you can either do it manually or automatically. If you want to do it manually, you would actually take this set out, and you see a raindrop here, and you would hold that down and actually would start running, it would start priming the formula through. Otherwise, we can prime automatically with the pump itself. So I'm just gonna put the set back in, close the door, and hit prime. And because there's no formula in it, nothing's happening, but you can hold it. And it reads to stop, let go. So as soon as you're done and you start seeing all the air bubbles disappear and the formula gets to the tip of the tube, you can set that to go as well. And then when you're done, you're ready to go. Same thing. Detach the cover from the tube itself, attach it to either the extension set or the patient's G site or J tube site, and you're ready to feed. So you hit run, and it'll start running. You can pause it whenever you want, but otherwise it's going to run until the 75 mLs over an hour, total of 250 mLs is done. and then to turn off, the easy on-off button.
For clogged feeding tubes, we do recommend these easy steps. If these unfortunately do not work, you will likely have to replace your tube. But to try at home, what you want to do is attach the syringe to the feeding tube and pull back on the plunger to remove as much fluid as possible. Then you want to administer 10 mLs of warm water. You gently move the plunger back and forth to help loosen the blockage. If the blockage does not clear, you want to clamp the tube for at least 5 to 10 minutes. You allow the warm water to soften the clog. If you can see the clog, you can try to massage that portion of the tube gently with your fingers. After that 10 to 15 minutes, you want to unclamp the tube and repeat steps 2 and 3 again, which is moving the plunger back and forth with warm water or massaging the area that you do see. You could prevent clogs by flushing the tube with water before and after each use, which we've discussed, and administering medications separately from one another and using diluted liquid forms of medications when that is possible, of course. I get this question often, and it is not recommended to use soda to declog the tubes, as this could erode the tube. Yes, it technically works, but over time, if this is your go-to, you're going to erode that tube and it will need to be replaced. If you are prescribed a pancreatic enzyme, you can flush that through the tube, and that tends to break up any clogging as well. And basically, it's a sodium bicarbonate, so baking soda and warm water. You can put that through the tube along with the pancreatic enzymes, and that would also be a potential solution. With any enteral feeds, you may run into some unwanted GI symptoms, such as diarrhea, constipation, nausea, or abdominal pain or distension. You always want to consult with a dietitian or your physician before making any changes, but we will go over some possible causes of these GI intolerances as well as potential solutions. Again, it's just something for you to note, but we don't recommend you going out and switching your formula without first talking to the person prescribing your formula. With diarrhea, some possible causes are medication. So if you're on antibiotics, sometimes that can, one unfortunate side effect could be diarrhea, fiber or lactose or simple sugars in the formula itself, or just too much overall volume. So some possible solutions. So obviously with the medications, if these are short term, hopefully when they, are DC'd, the diarrhea will resolve on its own. But if this is something that's a long-term medication, you might want to ask your physician if there are any substitutions. And if there are not, you can add, of course, an anti-diarrheal medication to your regimen. Again, I wouldn't recommend you just buying something off the shelf. You would have a discussion with your physician before making any changes. With fiber is an interesting source because sometimes it can help with diarrhea and sometimes it can exacerbate it. So you want to, talk to the dietitian or doctor and see how much fiber you're actually getting per day, and then decide if this could, one, be the potential culprit, and if so, we could look to increasing it or decreasing it, and that would probably be with a formula change. And if it's any specific ingredients within the formula, such as lactose or any added sugars, we'd look into that and potentially change the formula as well. And then with too much volume, so you're not able to digest the formula, and it just, creates diarrhea, we would look into decreasing the rate or change the administration method. So if you're being bolus fed and it's just turns out to be too much for you, we could look into changing it to gravity or pump feeds as well. With constipation, the number one cause is typically dehydration. So this is something that is extremely important. We want to make sure that we're getting the adequate amount of free water along with our formula every single day. So that is something that you will work on. I think that most people do go home with the right prescription, but sometimes depending on what's happening at home or any illnesses and things like that, you're at a greater risk for dehydration. So of course the solution for that would be to increase your hydration and ensure that you are properly hydrated. With constipation, again, same thing with that fiber can create diarrhea, can also create constipation. And again, you'd have to look at whether to increase it or to decrease it. Likely it would be increased, but sometimes you would have to decrease it depending, again, on what's happening. Decreased activity. So if you're sitting for long periods of time, or if the patient is unable to be mobile, this creates constipation and slower movement of your GI tract. So you want to increase your activity as possible, but if that's not something that you can do, usually increasing hydration, as well as there's different medications that you want to discuss with your physician. Delayed gastric emptying, so this kind of goes along with all of the above. You may need a prokinetic or a stool softener. So, along with the inability to be mobile, these are some agents or medications that can help that process for your GI tract and to kind of move things along. For nausea, some possible causes are the feeding rate or the concentration of the formula itself. Most likely, you would probably need to decrease the rate. If it's being fed too rapidly, you might feel nauseous. Same thing as if you were eating by mouth and you've either overate or ate too quickly, you would potentially feel nauseous. And the concentration too, it may be too dense, so you may need to change the formula. Oftentimes medications can create the feeling of nausea. That's a discussion you would have with your physician. Contamination. So, if your formula was open and something unfortunately got into it, or if you were reusing a bag, you want to make sure that there's proper cleaning and handling. And number one is always hand washing. So you want to make sure that no bacteria or anything is transferred between our hands, our workspace with the supplies, and the formula. So to create any illness or these symptoms. And then the delayed gastric emptying, same thing. We may, our formula or our food may not be passing through our GI system as quickly, so that could create nausea. And again, adding a prokinetic agent may be the solution for this. Abdominal pain and distension, possible causes are the feeding rate or concentration, goes along with the nausea aspect. You may need to decrease or increase depending on what's happening. Medications, of course. So, medication is kind of one of these possible causes for all of these things. So, a lot of people will think that it's definitely the formula. It may not be. It may just be a number of different medications that the patient is on as well. If there is a change in formula and there's a newly onset GI symptom or intolerance, then of course it probably is the formula, but we want to look at the person as a whole and what could be creating these GI intolerances and symptoms, and it's not necessarily the formula. So for any distension or pain, it could be a specific ingredient, an intolerance or a new allergy, which we would have to change the formula. And then when we prime the pump, that's one of our main reasons to do so, is to get rid of the air bubbles. So we want to decrease any of, gas within our GI tract. VerbalCare is a mobile app that increases communication between the provider and the patient. So in our case, the provider is us, Prompt Care, and specifically for our enteral patients. So when you go home with us, you will have access to this app. It works with both Apple products as well as Android, so you will either go to your store on your phone or tablet, and you can type in VerbalCare. And here is a picture of what that app looks like. So it is a green icon, and it says VC VerbalCare. Currently, there are 3 categories to choose from once you're in the app. There's the inquiries, the educational content, and the signature buttons. For inquiries, we will go over this, and this is what we will, that the patient and their family member can update monthly. The educational content is an overview of prompt care and contact information, as well as a informational packet that was developed for our patients. It goes over most of what we are going over in this video, but it's just another resource to use and to read from directly from the app. And then the signature button is if there's any documents that need to be signed. The inquiries page, if you click on that, it will bring you to a page that looks like this. It says inquiry detail, and it will say enteral formula supplies for your month. And at the bottom, you'll see it says 1 out of 10 completed. You press continue. It will ask you a number of different questions. Who is the enteral formula and supplies for? Who is your following physician? Did anything in terms of address, phone number, insurance plan change? If so, you have the ability to update any of this information, following physician, address, phone number, etc. And then you will click on what formula and what supplies are needed for your next month, and if there are any changes. So it's just a really easy, nice way to do your resupply monthly, rather than having to call our main line and having to wait for prompts there. You can do this through the app itself, and you will have notifications through the app when your monthly supply is about to be up. It should have a notify with like a red flag that you need to fill out this information monthly, and then click on submit. So it's just a great way to ensure and communicate with us what is needed and if anything has changed. The last category is the enteral information packet that I discussed earlier. Here is a picture of what that packet looks like. It's about 10 pages, and it goes over basics, and then the administration methods of bolus, gravity, and pump feeds, as well as declogging the tube, symptom management. So a lot of information from this packet was taken out and put onto the video so that it might be easier or just different to learn about, but it's great to have access if you're unable to sit and watch the whole video. If you're out and about, you can have access through your phone and your app and just have a quick question and refer to that packet on the app as well.
If this video is unable to answer all of your questions, feel free to use the 866 number that was provided to you once you were at home with us.
If you do have any questions, PromptCare's main line for enteral is 866-776 6782. Some other resources that we'd like to give our patients as well as family members is the Oli Foundation as well as Feeding Tube Awareness, which are the two links provided on this slide. The Oli Foundation is a nonprofit organization which provides education, advocacy, and networking to those with enteral nutrition support at home. And you can also donate any unused, non-expired formula or any unused supplies if you are weaned off your enteral support, which is great. And then the Feeding Tube Awareness organization is dedicated to providing pragmatic information for parents as well as caregivers on handling every aspect of tube feeding and navigating really every day-to-day life with a child who is being tube fed. So our patients that are in the pediatric sector. So both of those resources are fabulous, and we encourage all of our patients to at least just take a look and see what they're all about, and it's just another way to feel supported outside of prompt care.